Hi everyone, this is Dr. Mohammad Abdullah Salim. I am a consultant pulmonology and sleep medicine expert, Kera Hospital, Malakpet, Hyderabad. Friends, I am going to talk about little bit. I will not take your much of the time. I will discuss only about the tuberculosis, asthma, and ILD. So I will start with the basic topic, that is tuberculosis, which is an Asian disease and it is still the enemy of humankind. There are thousands of deaths globally in an year. There are many morbidity, mortality. This is an infection which is caused by the bacteria which is transmitted from one individual to the another individual via air and then a direct contact. Females are most commonly infected compared to males because of their nutritional status and because of their low immunity, and other individuals, those who are as high risk of tuberculosis are the patient those who have diabetes, hypertension, kidney failure patient, and the patient on the dialysis, and the cancer patient, those on chemotherapies, and the patient those who are on steroids therapy for a long period of time, and the individual those who have a low nutritional status or low immunity or immunocompromised individual. These infections can affect to any part of the body, including your brain, eyes, lungs, liver, kidney, etc. The most commonly the tuberculosis affect your lung because it is a majorly transmitted from one individual to the another individual via air. This is called pulmonary tuberculosis. And other infection, other tuberculosis which is affecting to the other bodies are called as extrapulmonary tuberculosis. Tuberculosis can easily be preventable, curable, and easily treatable. Earlier there are many medications for injections and tablets and so on, so for the treatment of tuberculosis. Now we have advanced medications which can easily be treatable the disease. Tuberculosis common symptoms are fever, which is specifically evening rise of temperature, night sweating, appetite low, cough which is persistent for about 2 weeks, 2 to 3 weeks, and in advanced stages the patients may develop breathlessness, and eventually he required hospitalizations if it is not treated on a proper time. These are the common symptoms of treatment, and whenever you have this following symptoms for a long time, for about 2 to 3 weeks, you have to consult your doctor. Doctor will write the investigation for tuberculosis to identify what kind of tuberculosis is it really affecting to the treatment, what he is going to write. So based on that, he will check the site of infection first. For example, if it is respiratory, he will check your lungs, he will check your sputum examination, and he will write, if it is necessary, he will write a CT scan and so on. The treatment part of the tuberculosis there are certain medication which is 4 to 5 medication in a combination has to be taken for a couple of months. So your follow-up is be necessary. You have to periodically visit to their doctors and take a special expert observations on patients on TB drugs. TB drugs are as good as bad. These drugs can cause a complication like liver problems, kidney problems. So your pulmonologist or the TB specialist has to monitor all these other issues. The common preventive measurement for prevention of tuberculosis are cover your face with a mask, avoid exposure to the crowded places, maintain a distance in infected individuals, maintain the social distancing is the most common thing. What we have seen in the last few years during the pandemic, I think most probably because of the social distancing, home quarantine, there are significantly reduced in the patients with the tuberculosis. After the pandemic, we see again the rise in the tuberculosis patients. So we suggest to be prevent the exposure to the contaminated or congested areas such as in the bus stands, railway stations. If you are exposed to such area, please cover your hands, maintain the social distancing, maintain a proper nutrition, take a vaccinations for pneumonia and influenza periodically to prevent secondary bacterial infection as well. So with these measurements, you can prevent the tuberculosis, and there is a good and significant effective advanced treatment available for all the patients of all kind of tuberculosis. Thank you.